tell me about yourself. How long have you been working at in Upland? What's the name of your salon?
It's called The Both of You, and it's been there for 30 years, and I've worked there 24 years. And my dad owned it before, and then he passed a couple years ago, and I inherited it.
So
So,
it's a family business.
Yeah.
Do you have any siblings that work with you?
no, actually, I don't. No,
Just you?
just me. Yeah, my aunt used to work there, and my sister, but they've since gone their separate ways too. So,
You still enjoy what you're doing?
oh yeah,
That's good.
yeah.
Okay, so let's see. What is your symptoms? What's wrong, so to speak?
Well, there's not really that much wrong now because I feel better now. But when I was having symptoms, it was just chronic pain, dreading getting up in the morning because facing a day of standing all day, being a hairdresser was difficult. So I extreme pain on a scale from 1 to 10, a 10 plus. It would be sometimes take me to my knees because it was so painful.
And was it consistently with you?
Yes, I would be okay when I first got to work for about the first hour, and then after that it was extreme right away, just from, I guess, standing.
And what had you done prior to, excuse me, what had you done prior to coming here to seek help?
I did everything besides surgery. Surgery was my last option. I did just absolutely every procedure there is to do. And surgery, they wanted to do a double fusion, and that was my last hope. And
How close did you come to having that?
I came pretty close. Besides just making the decision to do it, I mean, I didn't have any other options. That was it. So it was just making the decision to take the time off from work and be incapable for 6 months is what they said, I guess. So it wasn't something I wanted to do for sure.
So other than work, how did your condition affect your life?
I think the worst was not being able to pick up my daughter, just do things with her, and I was pretty much not able to do anything. I couldn't stand for a long time. Then it got to the point where I couldn't sit. I used to be able to sit to get the relief, and I couldn't do that. And so basically sleep was about the only relief, and sometimes that wouldn't even do it. So, yeah.
And how did that affect your life, and how, not necessarily physically, but from a mental aspect and frustration?
Very depressed. Often thought how I was going to live the rest of my life like this, in that much pain. And I was just not a happy person, very depressed, and didn't see an easy out for sure.
Yeah.
So it was hard.
How did you meet or find out about Dr. Porterfield and Dr. Mike?
It's kind of a weird story, but I actually went to my mailbox, and there was a packet in there, and it had their information and a little bit of a story of a couple people that had come here. And I was to the point where I would try anything before surgery, so I called and left a message, and they called me the next day. And it was funny because when I asked them how they got my address to send the packet, they said, well, we don't do that. We don't have to send out that information. So it's still a mystery of how I got the information. I really don't know.
And how long ago was that?
That was probably, I'd say 6 months ago, maybe.
Okay, so a little before Christmas?
Yeah. Yep.
Okay. And what has been your treatment since then?
Just the coming back here, doing the checkups afterwards, and the exercise ball, the blow up ball, and just kind of doing that, walking, and drinking lots of water.
Lots of water.
Yes.
Okay, there's a lot of ideas, so to speak, from many people about chiropractors.
Mm-hmm.
Okay. What were your thoughts coming into here, and were you skeptical?
Yeah, absolutely. I was skeptical. Chiropractic to me was always very scary because, especially when they got into the neck part and stuff, it was just, I would actually get hyperventilate, because I was so nervous about coming to a chiropractor. But at this point, I was in so much pain, I was willing to try anything. So I was actually nervous that they weren't going to take me because there was, they had to go over your information and make sure that you were, able to, do their procedures and stuff. So I was very nervous that they weren't going to accept me.
So what was it about them that calmed you as far as being nervous and overall being skeptical?
I think just the you felt very comfortable coming in here. I mean, from the minute you came in, they were very nice and I think true. I mean, you could tell that they were really concerned and really, worried about you and your situation as an individual, actually.
You've been to several different doctor's offices, obviously trying to figure out what it is you need and what's going to help you. What set this office apart, if anything?
I think I liked that it was Christian, or had that part of it, the prayer, and that made a huge difference for me. And they just seemed concerned, actually, in your case individually. Like they were really concerned about your outcome of what was going to happen to you, and that's, I never got that before, ever. I mean, they would call and ask how we were doing or how I was doing, and so just the follow-up even was great.
So you're not a number patient?
Absolutely not, yeah.
When did you notice things starting to get better?
Well, it was actually, I think, the last day of my treatment when I was doing the machine, and I was really nervous because I wasn't really feeling anything different, and then they readjusted the weight, and it was as soon as I got off of it, I knew that something was different. So they gave me, I did another week at that setting, and it was just all better from there, believe it or not.
And let's see, obviously it says describe how they help you, obviously how they help you. How was your life better or different as a result of their care?
I actually, I guess, enjoyed going back to work. I was not crying every day, I mean, it was just good to feel good again. It just felt good to feel good. That's about sums it up. I mean, I hadn't felt good in a long time, so I just, I could go to work and not be in pain. I could get up, and there's a lot of things. Just walking used to hurt me, so just being able to do the everyday walking was nice.
Go to the mall.
Yes.
Anything.
Yes.
Now, are you done with your treatment completely?
Yes.
Okay. Let's see. If I just make you the day, okay? If I came to you and I say I have back problems, I have a lot of pain in my legs, what would you suggest to me?
Definitely to try the treatment. That it's only a positive experience. There's, nothing negative about it at all. So it would just be an added plus. It couldn't hurt. To come in and it would, I feel, would help most people. I don't think that it wouldn't help. So, and it's a positive experience all the way around.
And how would you describe the treatment?
A little scary at first, but after the initial, first time of getting on and, doing what they do, I would fall asleep a lot of the times.
Yeah.
It was comfortable. I'm a little claustrophobic, so that was a little hard for me, but after getting past that, it was okay.
So if someone came to you and said that they have back problems, but they're skeptical, I'm not going to a chiropractor type of attitude, what would you say to convince them?
I would say that this, to me, is not a chiropractic quote. I considered to me it wasn't that kind of an experience at all. I'd never felt that I was actually at a chiropractor's office. It was more just a different experience than that.
Yeah.
So, and a lot of the things that they do and use were different things that I've never experienced. A lot of the machines are different, and so it was a good experience.
So, okay, in 15 seconds or less or so, tell me, even if you have to repeat yourself, tell me about your experience here.
All in all, it was a great experience. It was a little skeptical at first, but they're just caring people and really do care about you as an individual. And it was wonderful because I feel good.
Great.
I really do.